roll for me, Mike. Come to help.
Okay, is that?
February 16th, Senator Bouchard.
Here.
Senator Furphy.
Here.
Senator Hutchings. Senator McCune.
Here.
Chairman Baldwin.
Here,
Thank you.
audience, we're live in person and online, so use your best behavior. We have begun. Okay, so keep your conversations to don't have conversations. Okay, just a couple of reminders or rules. If you have cell phones, please check them. Make sure they're on silent. We have a rule in this committee. If your cell phone goes off in this committee, you buy donuts for the next meeting. Even if you're not coming to the next meeting for anything, you will come and you will bring donuts, chocolate glazed ones, hopefully. Second reminder is that during the procedures here, all talking with those who are testifying and with the committee needs to go through the chairman. It's a way of keeping things in order and keeping it straightforward. And finally, the reminder would be that, we're here to take your testimony. We're not here to fight or argue with anybody. Not today. Another day maybe, but not today. Today, we're all going to be civil, and then we're going to keep this open. The committee will ask you questions. They won't come out there and choke you or strangle you. We will be taking comments online as well as in person. We'll go in order and do those. So with all those reminders, let's go ahead and let's get this party started. The first bill before us committee is Senate File number 36, Pharmacy Benefit Manager Act enhancements. I put this one first on purpose. We've heard a lot of hours of testimony on this one. And I would ask those who testify, if somebody else said it, paraphrase it, keep it short if you can. I'm not going to limit testimony. Anybody that wants to testify, more power to you. We want your testimony. That's why we're all here and online as well. But we don't want to drag this out. I would tell you that, if the committee chooses this hill to die on, that you're going to hear screaming and gnashing of teeth, and that gnashing and screaming will be other bills that don't make it. We have a very short time frame in this session to get bills heard. We don't know how many bills we're going to hear. That remains to be seen. But ultimately, if we spend all of our time on one or two bills, other bills will not be heard in committee. So, we've heard lots of testimony. If you've got something new, we want to hear it. New ideas. There's a couple of amendments I know, but new information. But if somebody else is giving your testimony, just get up and, keep it short and say, yep, I agree with Bob, or I agree with Susie, or however that goes. So with that, Senator Hutchings, would you like to present this bill to us? You can choose somebody from the audience if you would. Very good. Go ahead.
Thank you, Mr. Chairman. Like I said, I wasn't prepared to be first, but I don't know if you want me to go through the bill again.
I think
Or
right now,
just-
Senator Hutchings, you don't need to go through page by page.
Roger
Just give
that.
us a synopsis, where it came from, what its intents and purposes are. We'll go through the bill page by page as we work the bill.
That'll be good.
That
And we
would be
do
best.
have a couple amendments we'd like to present as well. I'm trying to find the sheet I worked off yesterday. I think that was the best sheet. If one of you have that sheet, you can throw, I did print it and it was in my packet, but again, not prepared. You know what it looks like. Well, let's go off of this one. How about this? Okay, we'll go off of a sheet, Pharmacy Benefit Managers Acts enhancements. One of the things, I don't know if it's been said, is, Mr. Chairman, is the work the committee has done on this bill. The subcommittee that you put together, getting with Andrea, Todd, Harlan, and Melinda Carroll, and going through legislation that has already passed in other states. They picked out what was good, what was going on here in Wyoming and put it in this bill. So nothing is really new. We're not doing anything strange. Supreme Court has said the acts that they want to stop or rein in is permissible. So that's what we're trying to do here. Across the nation, pharmacy benefit managers, and I'm going off of this sheet, are driving up patients' insurance premiums while driving out essential community pharmacies. The Pharmacy Benefit Manager Act Enhancement Bill aims to take the power out of the middleman's hand by giving Wyoming consumers the freedom to choose where to receive their pharmacy care, where and how in some instances. Why Wyoming needs this bill? Just 3 PBMs control approximately 80% of the prescription drug coverage market, creating a makeshift monopoly that steers patients to the PBM's own mail order pharmacies instead of local Wyoming pharmacies. PBMs drive up the insurance premiums. And what I'm gonna jump forward so I don't spend all day on this, but when you go through the bill and you see each section that's gonna add to our statutes, each area is reasonable. Each area is an area where our local pharmacists are finding difficulty and they want to rein in those practices. So with that, I'm gonna allow one of these two ladies to jump in and add anything new that they think is gonna be of value to getting this bill to the committee as a whole.
Chairman Baldwin, I would just like to say that
Please introduce yourself for the record.
my name is Melinda Carroll. I'm a pharmacist here in Cheyenne. Chairman Baldwin, I am here to answer any questions about the bill. Reassure everybody that yes, this is language that has been pulled from other statutes that have passed in other states. It is nothing that we made up on the fly. And so I would like to reassure everybody that this language has been vetted. The other thing about this is just bring a few things to the committee's attention. The Federal Trade Commission is taking comments on investigating PBM practices, and they will vote on that on Thursday because of the practices that have gone on. It is yet to be seen what they will do on that. However, I would like to say that the Federal Trade Commission doesn't get involved if nothing's happening. So I would say that this legislation is to help rein in some of those practices that are questionable that the PBMs partake in. And I would stand for questions.
Very good. Further comment? Go ahead. Introduce yourself and share.
Chair Baldwin, I'm Andrea Todd Harlan, and I'm Director of State Government Affairs for A-Strip Companies. We own many business lines in the pharmacy industry, including retail community pharmacy, of which we have several customers in Wyoming. I participate for my customers all over the United States to help reform legislation pass so that they continue to do their job in their local communities. I would like to remind you that this very long legislation, as you said, we had, I think, over 14 hours of testimony and discussion on this bill in the joint committee. And then on top of that, the working group. Representative Wilson did have some amendments, which solved some of the opposition's concerns with this bill. She used the Healthcare Act, Reimbursement Act of 1985. We've reviewed that, and a lot of it is very sufficient for some of the things that we were trying to accomplish.
Very good. Questions, committee? I just have one. I would like you to if you could, just very succinctly, just maybe give me an itemized list. What changes that this bill makes as opposed to what we currently have? Just brief.
So Chairman Baldwin, this bill brings in the choice aspect for the consumers. Right now, PBMs can still steer their patients. It basically makes it so they cannot have practices where they reimburse below cost to pharmacies. it makes it so they cannot reimburse their own pharmacies higher than other pharmacies. It also gives us a mechanism to monitor what the PBMs are doing where we did not have that mechanism previously. Right now, they only have to register. They don't have to report what they are doing. All of those things will help improve transparency of the system and what the practices are, and would give pharmacy a little more information, and that would allow us to, it would help us with some of those appeals that pharmacies have to make that we do make to PBMs. So when they underpay us, we appeal to the very person that has already decided that they want to underpay us. And so those appeals will become more public record.
Second question is that, and I know this bill is directed at the independent pharmacies, who we worry a lot about in Wyoming because there's a lot of them in the small communities. How will this bill, if enacted, how will it affect the bigger chain pharmacies?
Chairman Baldwin, this bill would honestly help all pharmacies, because all pharmacies right now are minimally profitable, if profitable. So grocery store chain pharmacies are often carried by the front end of the store and don't turn a profit. Some of those other bigger chains, CVS did come out with a statement, I think it was last week, stating that they do not intend their pharmacies to be profitable, that their profits will come from their PBM, that all of their profits will be coming from their PBM. And so that's even they're saying, we're not paying the pharmacies, we're gaining profit. However, they own a PBM, so it's easier for them to move those monies around. So I would say that, yes, it's also going to help the larger chains. And I just think that it would increase competition, and I don't think competition is ever a bad thing in the market.
Further questions, committee? Go ahead, Senator Furphy.
Thank you, Mr. Chairman. I don't know how the system works, so let me just ask this. If pharmacy benefit manager refuses to renew your contract, do you have options with other PBMs?
Chairman Baldwin, Senator Furphy, if they refuse to renew your contract, yes, there are other PBMs that are out there. However, as was stated, there are 3 major PBMs that cover around 76% of all covered lives in the United States. So if one of those 3 were to refuse a contract, that right there could take out a third or more of that patient population that you can serve. And so it is very detrimental when they refuse to renew contracts, or they can offer contracts that you cannot refuse, because if you did, you wouldn't have a patient population to serve.
Further questions, committee? Okay, you are off the hook. Don't go very far away. Unless Senator Hutchins, you'd like to ask yourself a question.
No.
Okay. Okay, that's why I got you up so early. I want to make sure you're awake. Okay, let's hear from agencies and departments first, if we could. I see. I knew he was going to jump up. Welcome to Labor and Health. First time for the budget session.
Mr. Chairman, thank you. Jeff Root, I'm the insurance commissioner. Along me is our new policy analyst, Bryce Hamilton. I previously sent the committee a 1-page with proposed amendments to the bill.
And that's
all I was going to cover, if that's all right.
Your bill here. Okay, go ahead.
All right. The first 2 amendments are simply typos on pages 5 and 6, line 16 on page 5, line 16 on page 6. They reference Title 25. Well, that's Title 25 is actually the institutions of the state. So corrections fits under this not Title 26, which it should be, which is the Department of Insurance. So I just think that typo needs to be changed. The larger amendment, starting on page 19, line 7, and going till page 20, line 6. We will ask that this appropriation section be stricken and replaced with what we put together. It's when we previously presented before the Joint Committee, we submitted language, and what we asked for was 1 full-time position, 1 full-time temporary position, and then the ability to assess up to $250,000 a year each year to hire vendors or experts to help us administer the program. When it was drafted by LSO, something was just simply lost in translation because we looked at it and we knew something was wrong. So then I called LSO and I asked the lawyer there, said, how do you interpret this? Because this is how I interpret how it's drafted. And the way it's drafted is there are no permanent positions. Both positions end in June of 2023, and there's no funding after June of 2023. And so I think with that in mind, I drafted this language. I tried to make it crystal clear. 1 permanent position that stays permanent, 1 that ends on a set date, and then the money to up to $250,000 a year for appropriations, authority to appropriate. And the thought being there is, if none of that $250,000 is spent in 1 year, we don't appropriate anymore. If 10,000 of it is spent 1 year, the next fiscal year will ask for 10,000. But we wanted to have that in there as needed for vendors. So, and with that, I'll stand for any questions.
Questions, committee. Right, Senator Bashard.
Thank you, Mr. Chairman. So your last statement there, that if it's one amount or if it's another amount, that's where we're at. You know, in the business world, we actually don't make those wide of parameters on. We kind of figure out how much we're going to spend and what we're going to do right away and execute that. So I'm a little bit worried about going to that much money when we don't know if we need it. I mean,
Mr. Chairman, Senator Bashard, fair question. We need to have the money there ahead of time so I can hire or have people under contract to do the work. So the money has to be front end loaded. I just can't pull money that's not there to hire someone when these start to roll in. I've estimated, I mean, I try to come up with a fair estimate. I talked to other states. Each state does a little bit differently. Some states have full-time attorneys that just do this. Some states outsourced for example, the spread pricing issue that's in the bill to an outside firm to ensure that none of the PBMs were doing spread pricing. We certainly have none of that expertise within our office. We'd have to outsource that. At the end of the day, though, this is money that's assessed from our insurance companies each year. And if it's not used, the assessment doesn't change. And at some point, if it's never needed, we'll just assess $250,000 less. And so, you know, our average insurance company pays $2,500 a year to fund our agency to regulate the industry. A $250,000 difference in that equates to like $50 per insurance company.
Okay. Further questions, committee? They all must be asleep. Okay, thank you very much.
Right.
Further agency and department comments? Welcome to Labor and Health. It's still early. It's before 8 o'clock, so it's early.
Good morning, members of the committee. My name is Ralph Hayes. I'm the manager of the Employees and Officials Group Insurance Program. Wanted to point out a few areas as far as the spend within our program. I did look at a 12-month period for our commercial plan last year. Last fall, when I was coming up with the fiscal impact statements, over a 12-month time frame, we spent at that point $50.3 million in our commercial plan, roughly an additional $16 million in what we call our EGWIP plan, which is retiree plan over age 65. It's like a Medicare Part D plan, which we did not include in this. For your information, the Wyoming Independent Pharmacies is about 10.8% of our total spend. Albertsons is 5.1%, Safeway is 2.3%, Kroger is 5.6%, Walgreens 14%. You can see that really the chains have the lion's share of the medical spend for the employees and officials group insurance members. Now we cover roughly, as of the end of December, 17,298 employees and retirees, plus their dependents. So that's a little bit over 37,000 members. So when you look at the prescriptions for that many people, it's significant. And I have the figures over the last 12 months of what our spend is on a monthly basis if the committee so desires. Now, when we were developing the fiscal impact statement, and I provided, and it's put into the online portion of it, there's 3 areas. First of all, we were looking at an ingredient cost increase because, you know, as we've heard from testimony, there's more reimbursement requested through this particular piece of legislation for the pharmacies. I'm not sure I really want to increase Walgreens, but I do feel for the independent pharmacies because they're the hard ones, which is 10.8% of our spend. But the ingredient cost, we figured 5% increase in total spend, which works out to be about $2.4 million. That was rounded down from my figures. The elimination of our coupon program, which is basically taking the specialty medications and pulling them away from the centralized location, which we do. We require all of our specialty medications to go to a single point. That cost us about $2.3 million. And the increased dispensing fees, $2.7 million. So altogether, there is a projected cost of an additional $7.4 million per calendar year. And that, of course, goes up over time. So I stand for any questions that the committee might have.
Questions, committee. Senator Hutchinson.
Thank you, Mr. Chairman. Thank you, Mr. Hayes. It's nice to finally get to see you again. I would like a copy of the data because we haven't seen that data at all. We just got testimony that this is the amount it was going to be, and it was just left at that. One of the things I'm wondering and it just could be my ignorance, I'm learning about all this stuff as we go. When you talk about price increases, 5%, 10%, 7%, whatever percentage, how does that come into play with your office when we're talking about the pharmacy? If you make a contract, and again, I may be ignorant, with the PBM or a company and say, whatever you do with on your side of the contract, how does that affect the local pharmacist? Or how does the local pharmacist desire to be treated fairly, not have patient staring, not give a patient choice in mail order? How does that affect the people that you've already made the contract with? If that makes sense.
Mr. Chairman, members of the
Go
committee.
ahead.
The state of Wyoming is the insurance company in this particular situation. So we are self-funded. We hire a pharmacy benefit manager to manage the program, and we just went out for bid, as a matter of fact. We're changing from a pharmacy benefit manager called Med Impact, and we, beginning January 1st, we moved to Caremark.
Can I interject just real quick question? How many bids do you get when you put that out for bid? How many bids do you get?
Mr. Chairman, members of the committee, we had 5 bids.
Okay, go proceed. I'm sorry.
Mr. Chairman, members of the committee, this program many years ago did not use pharmacy benefit managers. And in the bid process, we moved to using pharmacy benefit managers because the contracts that they make out there save the program money. Now, 10 years ago, you talk about spread pricing. We moved away from the model where spread pricing was part of it. We moved to a transparency-based contract 10 years ago. So spread pricing does not play into part in our particular program. And that saved us $8 million the first year. So our program is designed to provide a reasonable benefit to our members to attract and retain employees at a reasonable cost to the participating entities and the general fund. Now, as far as the pharmacy benefit managers, again, we choose them because of their contracts, and that's where our savings comes from.
Further questions? So I see two. We'll start again. Senator McKeon, go ahead.
I want to make sure I understood what you just said. Because I think I heard we're going to save money and the state's self-insured at the cost of putting the small guy out of business. I'm pretty sure that's what I heard. Am I right or wrong, sir?
Mr. Chairman, members of the committee, we've been using pharmacy benefit managers for 15, 18 years. I don't believe that the primary competition for the independent pharmacies, now this is my viewpoint, and I'm sure the pharmacies don't share this one, but that's why I brought up the fact that 10.8% of our spend is coming from the independent pharmacies. The majority of the spend isn't going to the independent pharmacies. It's going to the chains. It's going to the Walgreens. It's going to the Albertsons, the Sam's Clubs, the Krogers. So I would hasten to say from my perspective, and this is also talking with state employees, for instance, doing employee meetings around the state in Buffalo, talking with the Old Soldiers Home and talking to those people and having, of course, this is their perspective, but how they weren't using their local pharmacists. They were driving over to Sheridan, which is what, 32, 35 miles away, so they could make a shopping trip at Walmart for filling their prescriptions. So convenience, Walgreens, of course, 24/7. I think most of your competition isn't so much the pharmacy benefit manager, but major chains. But that's my perspective. Members of the committee.
Follow up, Senator McKeon.
Thank you, Mr. Chairman. I own a grocery store. I'm an independent. And I probably make up 10.8% of that volume also. I'm just saying it matters. We have 50 employees. So I'm kind of alarmed, and I'm going to ask you the question again. Are we willing to risk independence to save money for the state?
Mr. Chairman, members of the committee, when we went with the new contract with Caremark, one of the things we specified within that contract was to pay the independent Wyoming pharmacies, which includes the many chains except for the Albertsons, the Safeways, the major chains, a higher payment for dispensing fees. In fact, we increased it 50% over what we were paying under Med Impact. So we do understand that the independent pharmacies have some challenges out there, and we did make a change within the new contract to address that. But this particular piece of legislation, again, I've stated the fiscal impact for it. This was carefully, and to be honest with you, it's conservative, but it increased the cost to the program roughly $7.4 million in the first year, which is roughly a 14.7% planned cost increase in the commercial prescription drugs. That's significant.
Thank you. Senator Bouchard.
Thank you, Mr. Chairman. And I think we need to go back a little bit here because where the cart and where the horse is constantly being moved around here.
Yeah.
And for the people watching at home that haven't heard the countless hours we spent on this issue, we're talking about Caremark. They're owned by CVS. They're owned by the big box. So inherently, there's a plan here to drive it all to the big box. I mean, so I'm moving the cart and the horse back around here because you're saying that you're saving this money And people are conveniently going to the big box stores because they like it better, is what you're kind of said. I know from working with the people that in my community that they like to go to the independent pharmacists. But the problem is when we have all these coupons and these special deals on the back end, and sometimes with you shaking the hands and making those deals, that's what's setting this all up. Caremark makes, what are they? $25 billion. I mean, this whole thing with all these PBMs is a $500 billion industry, and they're getting a piece of the pie. And all I keep hearing is, let's save money the way you're saying. So I'm trying to see the other side of this, and I'm not hearing from you. How do we save our country by not being taken over by big box stores that own it all? And we've seen this during COVID, how hard it was for all these little businesses to compete when the big box stores got preference. So how do you have any plans of how we help these independent pharmacists stay where they're at? Because if we lose them, then all we have is whatever they charge us at the big box store. It's going to turn around, and it's going to get worse if we don't start equalizing this.
Mr. Chairman,
Go ahead,
members
sir.
of the committee. We don't twist anybody's arm to go to a big box. We don't encourage them to go to a big box. They are making that market choice on a daily basis. Now, you also figure that, of course, let me give you an example. How many employees do we have in Buffalo? Not very many. Your smaller communities are where most of your independent pharmacies are. Do we have a lot of employees there? No. Our primary entities are and participating employees are in Laramie, so Albany County, Laramie County, and Natrona County. And of course, we've got the community colleges out there also, but we are not driving people away from the independent pharmacies. As I mentioned, we just did a 50% increase in the dispensing fees for the independent pharmacies. So we are working to help the independent pharmacies. But the pricing practices out there and the buying habits of our members is driving their choices, not the Employees and Officials Group Insurance Program, except for the only drug which we do that is the specialty medications. And again, we did not put the coupon programs into place. You've seen the commercials. If you can't afford your medication, AstraZeneca will help you pay for your premium, which usually ends up maybe a $5 out-of-pocket expense for a $7,000 medication. Let me give you an example. Find the right sheet here. Oh, I'm afraid I might have given it away. Humira. Humira provides aids for people to take that medication. We put in a variable copay program 2 years ago, which maximized that. And we do it through a centralized pharmacy for the specialty medication. And we're talking about only roughly 3,200 scripts during the course of a year. But it's the majority of our spend on a percentage basis because these medications are $3,000, $5,000, $7,000, $15,000 for a 30-day supply. It adds up quick. But if you've got Humira, which pays 25% coupon program to lower the cost of that medication, and we can recoup some of that through this coupon program, which we do, and it isn't the local pharmacist or the PBM who's doing this, it's the drug manufacturers to drive people to their particular medication. Because remember, in any treatment class, there's multiple options generally of medications to treat that particular condition, but they want you to take theirs. And there's a lot of heavy consumer advertisement to drive people that way. So what we do is we put together a program which captures part of that, returns some funds to the state. And again, our first year at 11 months saved $2 million. That's less premium, that's less general fund expense for the program, that's less premium out of pocket expense for our members. Anytime we increase the cost for the program, it's more general fund for employer contribution, it's more out of pocket expense for the employees, and especially for the retirees who pay pretty much all of their premium.
Thank you. Follow up, I would remind the committee, let's not dwell too long, but go ahead, West Senator Bashar.
Thank you, Mr. Chairman. So I just want to go back because we're talking about this coupon again. And we've talked about this. I mean, it's like, I don't want to keep beating this dead horse, but this is a scheme. When you have the company can own a PBM, even some of the on the pharmacy end, right? Big box own their own PBM. If they control that whole coupon scheme, then they're controlling that market. That's what I think what we're trying to get at here is there needs to be less control. Maybe you do save some money right now, but eventually we're going to put everybody else out of business, and then there will be no more money to save because the competition will be gone. That's what's happening here. So that, I mean, I won't keep beating this dead horse, but that's where we're going.
Is there a question in there, Senator Bashar? Done. Okay. I would remind the committee, we need to ask questions, not provide public comment. Let's ask questions. Senator Hutchins, go ahead, please.
Thank you, Mr. Chairman, and I'll try to be brief. I'm still concerned, Mr. Hayes, about the cost, especially after your previous testimony. What I'm wondering is what part of Senate File 36 causes a price increase? Is it the appeals process? Is it pharmacy choice? Is it just reimbursements? When I say just, I'm talking about just, fair, adequate. What part is making it go up to 7.4 million? If there's a part in here that we can amend out because of that figure, let's work with that. Thank you, Mr. Chairman.
Go ahead, sir.
Mr. Chairman, members of the committee, when you get into the page 5, line 20, using the national average drug acquisition costs, we believe that will increase a minimum of 5% costs, or that and the combination of the whole sale acquisition cost. So everything I've heard for is increasing the reimbursement to the pharmacies. Am I correct? Which means we end up paying more as a plan, and our members end up paying more in premium. So that's the portion as far as the ingredient cost. Now, the dispensing fee, that's pretty clear cut. I mean, we pay X amount in dispensing fee. Testimony last fall was the pharmacies say they need $12.40. That was a national study that was done by Independent Pharmacy Group. So if we move to that particular piece, that's where we get into the $2.7 million additional cost to the program. Having people no longer utilize the mandatory mail order where we can't take advantage of the manufacturer's coupon and get a piece of that back from the manufacturers. Loses us a little over $2 million. So each one of those pieces has a separate impact in different ways, and I broke them out so that you could see exactly where those come from.
Really quick, Mr. Chairman.
Go ahead, follow up.
So it sounds to me, and I could be wrong, that the way you set up your contract is what causes these problems. Is there a way to set up a better contract? Why would we want a contract that's telling us to do this, this, and this, and this, when it's going to make one portion of our group suffer? Can you answer that?
Mr. Chairman, members of the committee, you know, again, we are not advocating our members to move to the chain box stores. We're not forcing people except for the special medications. I will say that because that piece of it saves money for the program. And quite frankly, the past legislature puts a lot of pressure on this program on reducing its cost, both the Appropriations Committee and this particular committee in the past. And we do that through our bid processes and plan benefit design. But we utilize PBMs because of the contracts they put into place, just like we use our dental administrator, which is Delta Dental, and their contracts they've negotiated with medical providers. And also the medical portion of it, which is Cigna at this point in time, and the deals that they have made with their medical providers to provide the benefit at a reasonable cost. Now, I do not know what those contracts are with those independent pharmacies. Again, we are trying to address it by increasing the dispensing fees above and beyond what the chains are getting within our Wyoming independent pharmacies.
Okay. Go ahead, Senator McEwen.
You stated that you're not driving people to box stores. So I'm going to go back to my grocery store analogy. If you made me buy my goods from a place in Bentonville, Arkansas, do you think they're going to take care of me? Or are they going to take care of their own selves first? And that's literally how we're crushing these guys in my mind. Would you agree?
Mr. Chairman, members of the committee, I'm striking a balance here. Am I crushing the independents? I'm taking a small portion of the prescriptions away from them, but only the specialty medications. Everybody else has a choice that they can do. And they can choose to, we have a mail order program out there that's for other maintenance medications. And in our particular case, it's 5.2% of our spend across the state. So it's much less than the change at 10.8% of our spend. So a lot of people aren't using their maintenance medications through mail order. They're making a choice, but the specialty, yeah, we do require it because of the extreme costs of it and trying to maintain a program that's viable and cost efficient for the state and its employees.
Very good. Follow up.
I spoke with a couple independent pharmacists before I came down here. And they were talking about maintenance drugs, not specialty drugs. They could fill those prescriptions 2 or 3 times. And then their patients were forced into mail order after that. So I go back to, how can you say we're not driving this to save money?
Mr. Chairman, members of the committee, the Employees and Officials Group Insurance Program does not mandate non-specialty maintenance medications, period.
Okay, go ahead, Senator Furby.
Thank you, Mr. Chairman. Very simple question. I think I know the answer, but does the state receive any direct reimbursement from the PBM that you utilize?
Mr. Chairman, members of the committee, part of our contract with pharmacy benefit managers is 100% pass-through of any rebates that are received. So yes, we do get rebates associated with that because again, that helps drive our costs down. And that's their negotiations with the pharmacy benefit, the pharmacy manufacturers. So we don't want them to have that. We want to pay them a flat fee. We want to receive that to keep our costs down.
Okay. Committee, should we let Mr. Hayes take a break? Do we have further agency or department comment? Go ahead.
Good morning, Mr. Chairman, members of the committee. I'm Corey Cooper. I'm the Pharmacy Program Manager for Wyoming Medicaid. And I'm here this morning just to, first of all, thank the committee. I'm really sure that the understanding is that Medicaid should be explicitly excluded from this bill. And an attempt was made to put that into the language of the bill, which we very much appreciate. We also appreciate there's been an extensive amount of work done on the wording of this bill over time. And what that has created is that the explicit exclusion for Medicaid and Medicare was put into the definition of health benefit plan in the language of the bill. And so that starts on the top of page 9 is where that definition lives at the moment. And the challenge that we have now is that the wording of this bill has been worked on to the extent that health benefit plan no longer appears in the bill other than in this definition. So as the bill gets worked and amended, there's a very good chance that the definition of health benefit plan doesn't need to be here because it is not in that phrase is not in the bill anywhere. And therefore the exclusion of Medicaid from the language of the bill would be stricken if that definition was stricken.
Can you point out the page and line number that's on? I'm sorry.
It's on page 9. I'm sorry, I don't have line numbers on the copy that I have, but it's at the very top of the bill.
Huh.
The definitions section is 2652-102.
That's not a-
Director Root has it for you.
Mr. Chairman, I think it's page 13.
Excuse me,
I think it's page 13.
page 13.
Thank you.
Oh, yes.
Yeah, there.
My
it is, the bottom.
apologies. I have a different printout. So it's page 13. Line number 20 is where that definition starts.
Thank you. Can we take note of that when we get working the bill? Okay. Any comments, committee, questions? Okay, thank you very much.
Thank you all.
Further agency or departments who wish to comment? Okay, that being said, we're going to move into the public here. And the way we're going to do that, we're going to be very creative today. We're going to do two comments or two testimonies who advocate for the bill. It will be followed by two testimonies who are opposed to the bill, which will be followed by two online. Okay, so if we can queue up those people online appropriately so they're ready when we get to them. So let's have the two strongest people who want to advocate jump up in front of us first. Don't fight over it.
Mr. Chairman, can we also remind online to raise their hand if they want to testify regarding this bill?
Okay. What? Okay, gentlemen, introduce yourselves and welcome back. We've seen you a couple times.
Mr. Chairman, I'm Scott Schmidt. I own North Star Pharmacy and Infusion here in Cheyenne. I am an independent pharmacist. And I have 23 employees, about $1 million a year payroll. And when I listen to the gentleman from the insurance side of things talk about a $50 million spend on roughly 27,000 people, that's a lot of money. So the PBM's involved in that $50 million spend as well. And how much of that $50 million spend did the PBM keep? How much of that did it reduce the members' premiums to the state of Wyoming? There's just not enough transparency that's involved in this, in any of these PBMs and what they can do and how they do it. Their practices are unfair and unjust. And anytime you process a coupon, whoever processes that coupon pays a fee. So if I accept that coupon at my pharmacy, I pay a fee. PBM doesn't pay a fee. That's how they get their clawbacks. And, you know, for us to be vital, I think, again, this pandemic has been to our advantage, so to speak, to emphasize the importance of independent or community pharmacy at this point. We've been on the front line since day one, and we meet our patients face to face. And that's invaluable. When these specialty medications come from the mail order, all it takes is one time for it to miss mailbox once, or it's too hot or too cold. Then the patient has to pay out of pocket because they've already paid their copay through mail order. So that's a $7,000 or a $10,000 or $15,000 expense back to the patient. So I'm just saying, I'm here to say that, you know, we're not asking for the stars and the moon, but we're asking to be treated fairly and not kicked around and taken advantage of. We know we're the low-lying fruit and it's easy. So they come after us first. And I've got the proof to prove it if you want to come see it. But again, I love the profession of pharmacy. I love the idea of being able to go out and take care of people personally, get to know them personally, and not just via a phone call or a teleprompter, or things like that. That right there would reduce healthcare costs tremendously by having us involved in their therapy every month.
And we appreciate that. So I was just going to relate a conversation I had with somebody that our pharmacists may be our most underutilized members of the healthcare team, period. We don't use near all the skills and all the training that you have, but that's for another day. We'll discuss that. Questions, committee? Senator Murphy.
Thank you, Mr. Chairman. Just would like your input. If we pass this bill, how is it going to benefit you directly?
Again, anything that's going to
Chairman,
increase, excuse me,
You're fine.
Chairman Baldwin, Senator Murphy, anything that provides transparency helps everybody. Our overall reimbursements will become better. Healthcare costs will go down because of competition. And it's just fair practices that way. I mean, it's in the transparency of the bill that will hold these PBMs accountable to not abuse and misuse what we've done, and allow us to keep dispensing medications at a fair and equal price to the big boxes or to mail order pharmacies.
Senator.
Thank you, Mr. Chairman. Mr. Scott, just a quick question on testimony that was given earlier that when the insurance company made their contract, they said that they stipulated in that contract that they would pay higher amounts, up to 50% for dispensing fees. Have you seen that yet? And if you have, do you think we can take that portion out of the bill and still have the bill help you out?
Mr. Scott.
Mr. Chairman Baldwin, Senator Hutchins, as of right now, with it being early in the fiscal year, I have not seen any difference yet.
Senator Bouchard.
Thank you, Mr. Chairman. See, I think the transparency issue is really big because we don't know how all this stuff works unless we ask. So I've seen stories from doctors saying that they had to wait hours, sometimes 12 hours, to get the whole process to work behind the scene just to get a prescription filled. And or even things where they limit where they can get that prescription. So sometimes they have to get it somewhere else and it takes longer. So it takes the personal care out, takes you guys out. How does that work? How does that happen when it goes through all those steps? and it moves it away from the personal care you guys can give, and then gets in this system, you know, with PBM sort of controlling that. So just the way we all understand how that works.
Go ahead.
Chairman Baldwin, Senator Bouchard, that does cause a lot of complexities in the dispensing part of pharmacy. Some insurances require prior authorizations on expensive drugs. And, it's not as easy just to say, I can go transfer this over here to here or here. And based on their insurance plan, if it's not covered across state lines, then they just can't get it at all. And then they're waiting even longer. So it is much more difficult if they got to jump through more hoops to get to that medication.
Very good. Let's move to the next testimony. Go ahead, sir. Introduce yourself. Welcome back.
Thank you, Chairman Baldwin. My name is Matt Meyer. I am an independent pharmacy owner up in Sheridan, Wyoming. And I will try to keep my comments here brief. Really, what Senate File 36 does and how it's going to benefit all pharmacies within the borders of Wyoming is basically increasing that transparency. When numbers are presented just in aggregate, there's no way to verify. There's no way to verify anything, whether things are paid at correct rates. And there's no accountability at that point. In terms of previous testimony of an increase in a dispensing fee by 50%, well, that's all well and good and whatnot, but when we're talking about the original dispensing fee being 90 cents, and we're increasing that up to $1.45 or $2, while that is much appreciated, and we've just had our contract reimbursement rates through Caremark cut for the ingredient costs of the medications, it's kind of a wash in that sense. So how patients are driven to different pharmacies, whether it's the state plan or whether it's other insurance programs, really all depends on the contracts that we are offered from the PBMs. And if you are told from your insurance agency that, well, yes, you can go to Matt or Scott's pharmacy and you can pick up that medication, but it's going to cost you $60 for a 30-day supply, or we have a contract with our mail order, or we have a contract with Walgreens or whoever that PBM affiliated pharmacy is, and you can have that same exact medication for a 90-day supply for $5. How can you tell me that the patient really has a choice at this point, especially when we're talking about people on limited income who are fighting financially for every cent that they have just to get through the day. So while the plan or the state or the insurance agency or even the employer may not be setting up saying, well, yes, we are gonna limit people to this particular sector, this particular part of the industry, the PBM on the backside of that can have a lot more influence in terms of how those contracts are offered and how they are choosing to pay out those dollars that the plan has agreed to pay for those medications, if that makes sense. Just also, the pharmacy has no control over the ingredient cost of anything that's set. We are one of the few industries that we do not get to control our own pricing. Coupons, yes, we accept coupons at the independent and other regional state pharmacies. So, when we take a look at all of this, it's difficult to make sense of it all. And it's difficult to follow, but there are so many things that are occurring behind the scenes, and we haven't even touched yet on patient care, just on how things are set up. It's interesting that this committee had brought up how do these things in the patient care aspect, how are those addressed? Well, I mean, I would like to just point out, when there's a problem with mail order or a patient doesn't understand their medications through their mail order, they are not calling their mail order pharmacy. Where are they showing up? Now I am taking care of somebody that I'm not even filling their medications for, because they need that care. They need that assistance in order to take their medication safe and effectively and avoid complications. So, I mean, now you're asking us to take on a liability aspect for something that we're not even being reimbursed for, and we do it. We do it, and even though you're not mandating it in the plans or in the contract with the payers, you are allowing this to occur because we are dealing with companies outside of the state of Wyoming that have so much control and influence over how this industry is being run. So, I mean, we could sit here and talk for a very long time and rehash a lot of things, but I think at that point, you know, I will just stand for questions.
Questions, committee? Thank you very much for coming down, gentlemen. Have a seat. Let's have two folks who are in opposition to the bill come up. Welcome, Mr. Novotny. Welcome to our committee. We don't get to see you often.
I know, Mr. Chairman. Good morning, members of the committee. My name is Bill Novotny. I'm here on behalf of the Wyoming County Commissioners Association. I'm a Johnson County Commissioner. The Commissioners Association stands in opposition to this bill, and it is a matter of additional costs and a burden that you're going to place upon the counties. In my own county, based on figures supplied to me by my county clerk, this is going to cost my county an additional $20,844.40 to fill the 1,681 regular prescriptions that my county employees use. That does not include prescriptions that may come up throughout the course of the year for an employee that goes in for an ailment. They get the flu. So we anticipate that we could see anywhere between 10 and 20,000 additional spend to cover that under the proposal contained in Senate File 36. You know, we look at it costing us about $12.40, and I believe that number was previously mentioned. We're going to see an increase on each of our prescriptions. My county is self-insured. We do use a benefit company to help us negotiate some of those costs, but we're in a community that has two independent pharmacists, and we encourage our employees to use those. If they choose to drive elsewhere or use a mail order option, that's up to them. But our opposition to this is a purely cost matter. When you start banning around numbers like that, we're talking about the cost of an employee. And as my valuation continues to drop, I've got to find savings or I have to look at the benefits that I provide to my employees. And we are not the highest paid employer within our county if you do comparable jobs. But what we pride ourselves on and our ability to hire and retain good employees are on those benefit costs, the health insurance and the other benefits that we can supply to them. So I'm going to now defer to my fellow commissioner from Weston County, but we'd be happy to answer any questions. I think looks like Senator Bouchard may have a question.
Let's hear from Commissioner Wagner first, and then we'll ask you both questions. Go ahead, sir.
Morning, Chairman, members of the committee. Just reiterate what Commissioner Botany said. We're fortunate we have, Ed Wagner, Weston County Commissioner with WCCA here. Our county is fortunate enough. We have 3 independent small pharmacies. One of our biggest fears is if we lose our pharmacies, we lose that one-on-one contact with the people. If we have to go to the big box chains, our closest one is an hour away. The only thing we can get overnighted is by FedEx. UPS doesn't do one overnight air to our county. So our county's getting older, our population's getting older. A lot of them don't drive very far. the medications need to be delivered on a daily basis, something daily is not that good of an option for us. Thank you.
Senator Bouchard had a question, I believe. Go ahead, sir.
Thank you, Mr. Chairman. I heard numbers, but the numbers I didn't hear are about the states that already have moved in the direction we're moving here. And it didn't seem like the sky fell in those states. And so have you looked at the other states? I mean, I understand that we pull these numbers up, but there's an undercurrent here to keep things the same. And just like we see in other legislation, every time that you come out and try to change things, there's all the talk about the sky falling. How could we have over 20 states that have done something and they're not paying more? So have you looked at those numbers?
Go ahead.
Mr. Chairman, Senator Bouchard, no, commissioners don't regularly study other states and what they're doing in their prescription benefits. We are trying our very best to administer quality programs for our employees. And so we're looking at bottom line dollars and cents. And under the proposal before you today, those are the real costs that it's going to have on Johnson County.
Senator McEwen.
Understand you got a 20,000, couple $100 cost. After you've put those small pharmacies out of business, how much revenue are you going to lose? Is it going to be less than that? Because if they go out of business, the employees are going to go somewhere. So you're going to miss out on property tax, sales tax. And the commissioner from Weston County, sir, if your 3 pharmacies go away, you just admitted you're out of business there too. So my question is, have we analyzed what we're going to lose versus what we're going to save?
Either commissioner, jump in.
Mr. Chairman, Senator McEwen, if you look at revenue generated by a pharmacy, those are not typically taxable transactions. So you're really looking only at property tax. But what I would make clear is that our county is not the largest employer within my community. And certainly we do not want to put those small businesses out of business because of who we choose to fill our prescriptions with. I use my local pharmacy. It's a second generation small business in my community that we've used forever. So we are not trying to put anyone out of business. It's a matter of consumer choice. And, we are just trying to balance our county's budgets and provide our employees with good benefits. And this proposal will provide additional costs to the county that we're going to have to either cut services or raise the thresholds and things that we can offer in our employee benefit package. And that's just the reality.
Follow up, Senator McEwen.
I guess what I was talking about on the tax front is those employees buy things in your community. Those employees live in property in your community. They purchase fuel in your community. They support everything else. They increase the velocity of dollars. So I go back to, are you really saving money? And I'm just curious what you think you're going to lose by saving the $20,000. And I've heard testimony here today. It's unfair practices, and a lot of them are going to go away. So do we know what we're going to save versus what it's going to cost us? We know that if we save the 20,000, are we not going to lose more than 20,000? And I don't know what that number is, and that's what I'm asking.
Commissioner Vaughn.
Mr. Chairman, Senator McEwen, I don't have a definitive answer for that. And probably some of those employees at that local pharmacy could be married to one of my county employees. So it does have a real impact to us. And I don't want to in any way say that we are not supporting our local small businesses. And we we want them to succeed, but I also cannot mandate my employees to use one pharmacy over the other or say, you've got to go to this one, not that one. That's a matter of choice.
Senator Bashir, go ahead.
This bill doesn't mandate them choosing a pharmacy. To the contrary, what's happening here is there are things behind the scenes that are driving them to even big box stores only because the PBM is owned by that big box. So I think what you're saying doesn't represent what this bill is trying to do. I mean, can you point to this point of the bill where it actually forces a consumer to use a certain pharmacy?
Mr. Chairman, Senator Bouchard, I'm going to go back to the point that under this bill, it will cost my county an additional $20,844 a year on just the regular scripts, and then an additional 10 to 20,000, depending on how many other prescriptions get filled through the course of the year. And that's what I can share with you. I can't wager guesses on impacts of other things that are beyond what I can do in analyzing what this bill is going to do to my county.
Quick follow-up, go ahead.
Thank you, Mr. Chairman. So I just want to give a little follow-up and I want to know if you've really analyzed these numbers, because I want to know how much of that part that you say that we're going to spend more is going to the PBM. And so that's what's, because there's a $500 billion industry where the PBM is profiting. So these are all hidden profits behind the scenes. Do you know those numbers of how much the PBM and where all this other money is going in this prescription?
You can answer if you wish, but I suspect that you don't have knowledge. Go ahead.
Mr. Chairman, Senator Bouchard, I don't, because under HIPAA, I really don't get to see what types of prescriptions my employees are buying, or I see an aggregate number each month from our provider on what went out in prescriptions. And so that's the best analysis I can give you, is a raw aggregate number.
Quick question. Go ahead, Senator.
Yes, Mr. Chairman, thank you so much. Mr. Novotny, thank you. It's nice to see you again as well. My question is, I keep hearing cost. Where in the bill, if you can point to it, will these costs rise? What's the driver in the bill? And if there's something we can do to amend that out and still make our pharmacists whole, I would like to know so we can do that. So if you can tell me what portion of the bill would cause your fees to go up, I'd love to see it.
Mr. Chairman, Senator Hutchins, it's wonderful to see you this morning. I can't give you a specific line or number or section. It's a culmination of all of the different factors within the bill that we believe is what's going to help drive up those costs. So, but certainly we would be willing to sit down and try to go line by line and try to find, because ultimately we want to provide our employees with the best possible benefits at the lowest cost to the taxpayers.
Thank you, Mr. Chairman. And we agree. That's why we're here. We want low prices for everybody. Maybe you can't answer this question. If our state-run insurance company owns the PBM, is their insurance company, makes the contracts with you, makes the contracts with the pharmacy, wouldn't you think that there would be a way that everybody can make prices lower instead of putting it all on the backs of that local pharmacist?
You can answer if you wish.
Several,
yes.
Madam, I don't have an answer to that. And I wish I did. I'd be making a lot more money.
We're not going there. Okay. Do we have a couple online who have raised their virtual hands who would like to speak to us?
Mr. Chairman, yes, there are two online. One is currently in the room and I'll admit the other one.
Great. And I will ask whoever shows up there first to tell us loud and clear who they are and go ahead with their testimony. It's difficult to read the name from here, and I don't have my computer up. So I see someone in the middle of the screen there.
Is that me, Regina?
Very good. Go ahead, Regina.
Hi there. Good morning, everyone. My name is Dr. Lugina Mendez Harper. I've met with you all before during the interim session. I'm a pharmacist and I work with Prime Therapeutics, which is a PBM that uses a pass-through model with our 18 not-for-profit owner Blues plans, which includes Blue Cross Blue Shield of Wyoming. So I say that because I want to be very clear that we use a pass-through model, which means that we don't charge members more than what is paid to the pharmacy. I'm testifying in opposition. We have been engaged on this legislation throughout the interim, have an interest in continuing to engage with the proponents, but as it's currently written, respectfully stand in opposition. We've talked many hours on this. I want to just focus on a couple of points that I think deserves some clarification and some attention. At the end of the day, I want to make sure that the committee understands that you can mandate higher reimbursement for pharmacies, but I want to be crystal clear what that means. That means that in doing so, you're going to increase healthcare costs for Wyoming citizens and Wyoming employers. And I know the sentiment has often been, we're going to stick it to the PBMs and stick it to the insurers. But I want to make sure that folks understand that whether you're an insurer who collects premiums or you're a PBM who is administering prescription drug benefits, we are passing through costs and getting our revenue from citizens and employers that pay those premiums. So I want to make certain that there's a clear understanding. And I think whether it's the state employee plan, all the insurers that have spoke during the interim, as well as the PBMs, we've had a consistent message throughout the discussions and throughout the interim that that these increased reimbursement to pharmacies will increase healthcare costs, which will be passed on. So I wanted to just talk about two things. The first is the statement that PBMs are steering patients away from Wyoming pharmacies and resulting in no patient choice. So a couple of facts that I want to share with you. Because of the rural nature of Wyoming, all Wyoming pharmacies are in our pharmacy networks, which means there's not like a preferred pharmacy or an out-of-network pharmacy where there's a cost differential if you go to one pharmacy versus another. That's one fact. The second fact is that Wyoming is an any willing provider state, which means that we can't exclude a pharmacy if they're willing to accept the terms and conditions of the contracts that we're offering, whether it be a retail pharmacy, a mail order pharmacy, a specialty pharmacy. The third fact, there's no mandatory mail order with Blue Cross Blue Shield of Wyoming outside of specialty medications, which is similar to the state employee health plan. The next thing, Prime has rural pharmacy reimbursement rates for our pharmacies in Wyoming, across the nation, but especially in Wyoming, which again reflects the fact that it's such a rural state by nature. I also wanted to point your attention to the Board of Pharmacy Executive Director who testified early on during the interim session, and he stated during his testimony that there were only 4 PBM affiliated pharmacies in Washington, and only 2 of those were retail pharmacies. The other one was a long-term care and then a behavioral health pharmacy. Prime itself doesn't own any retail pharmacies, and we don't steer them to any pharmacies that we own. And then the final point on steering that I want to make sure is understood is that even when mail order is presented as an option for use, the industry standard is less than 10% of patients choose that option. When you look at the total picture of prescriptions that are dispensed. So just want to make those kind of succinct points about pharmacy steering, because I know that that's been one of the major talking points that we've talked about throughout this session and including today. The second thing that I wanted to just talk through, and I'll try and make this quick, is the money that pharmacies are making when they're dispensing prescriptions. So yesterday, we had a independent entity called Drug Channels that published an article titled "The State of Independent Pharmacy Economics." And that article was based on a survey that was done by the National Community Pharmacists Association, and that's the Association of Independent Pharmacy Owners. And what they found in digging into the data that was compiled by NCPA is that prescription profits for independent pharmacies remained remarkably stable over the last 5 years. And then they actually presented some numbers that give us a little bit of a picture of the national landscape. So in 2020, independent pharmacies gross margins on prescription drug sales was 20.8%, and they had a gross profit of over $11 per prescription. So certainly wanted to share that with you. It's again, an independent source of information based on this survey of independent pharmacists. One of the things that I also want to point out is when we're having discussions about the profit and what money is being made by all pharmacists, not just independent pharmacists, I want to kind of go back to some basic business principles. And I know Senator McKeown has been quite helpful in kind of helping us think about, let's get this down to, you know, the bare nuts and bolts of business. So what I wanted to say is, you know, no business makes a profit on every single transaction. You rely on making money collectively based on all of your business. And that's the same for pharmacies. So they may not make a profit on every single transaction, but when you look at their prescription dispensing collectively, they're making money. And that's supported by this NCPA report that came out about the 2021 business model for independent pharmacies. So one of the questions that was asked earlier was—
Regina, to start wrapping up, please. So we can-
Okay, sorry. So just, again, I just want to end with, you know, you can mandate higher payments for pharmacies, but I want to be very clear that in doing so, you're increasing healthcare costs for Wyoming citizens and employers. And with that, we oppose this legislation and ask that you not pass it.
Questions, committee, Senator Hutchins.
Thank you, Mr. Chairman. Lucina, it's nice to see you again.
Nice to see you.
I'm gonna just make a couple statements first, and then they may sound negative, but I'm gonna get them out there because you kind of said a couple things that I want to clarify. I've been working with this committee since this summer on this piece of legislation, and I've never, not once, heard anybody say we want to stick it to the PBMs or to the insurance company. So we won't say that that's happened because it's never in my hearing. I do remember a time when I did ask early on in Riverton. It sounds as if this whole PBM system is scamming the government. And the reply from you, Lucina, was everybody scams the government. And it's on record. So that surprised me, and it set a negative tone for me. One of the things we're not trying to do is pay a pharmacist a higher rate, give them a raise. We're trying to give them just pay for their work. That's what this bill is trying to do. One thing I'd like to know, if you've made a contract with somebody, how can during that contract session, prices go up on the consumer and the insurer? Then I want to know, I'm asking a lot of questions. If you want me to stop, I'll slow down. If the pharmacist isn't making the money, the insurance company isn't making the money, and there's only the PBM left in the equation, are you making the money? With NCSL tracking 81 bills in 29 states, that's telling my little pea brain that this is a very serious matter and we need to address it. We need to get this bill passed and help our local pharmacists out. Thank you, Luciana.
Go ahead, Regina.
Lou.
Thank you, Chairman Baldwin and Senator Hutchings. I'm going to try and answer your questions. Hopefully I can remember them. So as I stated from the beginning, Prime operates using a pass-through model with our Blue Cross Blue Shield of Wyoming plan. So that means that there is no difference of what we charge a patient or a member than what's paid to the pharmacy. So that whole spread pricing issue that's been raised several times is not something that exists with Prime and Blue Cross Blue Shield of Wyoming. I'm trying to remember what your other questions were. Can you refresh my memory on what I might not have already answered? I'm sorry.
Thank you, Mr. Chairman. Oh, I made some statements that don't need to be answered, but one of the things I was asking was if you've already created a contract for a year, 2 years, 3 years, what would cause the passage of this bill to increase the rates? If you've already got the rates set for 3 years, what's going to happen if this bill passes? That was one. And then if the insurance company's not making money, the pharmacist's not making money, the only person left in the equation is a PBM, are you making the money?
Right. So I've answered that second question. No, we're not, because we pass through all of the rebates that we obtain for the health plans back to them. We don't have a difference in what we charge the health plan and what we reimburse pharmacies for. The second question, or the first question, was about rates and how they can go up. So I think it's important to recognize that prescription drugs aren't a static industry. The price of prescription drugs changes every single day. And so that's where that's where rates have to, can fluctuate based on how those prices of drugs increase over time.
Thank you, Mr. Chairman.
Senator McEwen, go ahead.
I just have two quick questions. First one is, as I read through this bill, I'm not sure why you believe this bill that mandates cost increases. And my second question is, are the independent pharmacists who are testifying here today misinformed about pricing? So do you believe the playing field's even? Thank you, Mr. Chair.
Go ahead, Regina.
Mr. Chairman Baldwin and Senator McEwen, thank you for those questions. I'm going to answer the first question is asking about where in this bill we believe that is driving up costs. So throughout the interim session, the pharmacists had this bill and had language in there that had a $10.49 dispensing fee on top of the acquisition cost for the drugs. During the last committee meeting, well, 2 meetings ago, another figure was passed or was thrown out there for consideration, which was a national average dispensing fee, which is actually higher than the $10.49. It's actually $12.40. And again, that's from a national pharmacy entity organization. So where we're basing the fact that this bill as drafted is driving up costs is there's a definition on page 15 called pharmacist services, and it just combines it combines the goods and products, so the drugs that are being dispensed with the services that pharmacies provide, so counseling and things of that nature. So that's usually what the dispensing fee is intended to cover. So there's not a lot of clarity in this bill. So what we've done is use the figures that have been pointed out by the proponents of this bill on what they're wanting. So the 1049 and the 1240 payments is where we're seeing this is a huge cost driver. Can you repeat the second question for me? I think it was about an even playing field, but I want to make sure I understand the question.
Mr. Chairman.
Go ahead, sir.
we had testimony today that at one pharmacy, a drug might cost $30, and at another pharmacy, it might cost $5. And we have PBMs that own pharmacies. My question is, do you believe the playing field is equal?
And Chairman Baldwin and Senator McEwen, I just need to clarify, when you say it costs, are you talking about costs the pharmacy or costs the patient who's using that pharmacy?
I believe they're talking about the patient that gets a prescription.
Mr.
Chair
Chairman,
Baldwin and Senator McEwen,
you stated earlier that the average independent pharmacy is making 20.8%, right? And I
that is
think
what was
that's a fair
referred.
margin. So if they're making 20.8% and it costs $30, how can the other place make 20.8% and sell it for $5 if the playing field is equal? And I'm just asking if you believe it's equal.
Go ahead, Regina.
Chair Baldwin and Senator McEwen, I may need to circle back. I'm not really following this question because that's all about benefit design. So what a patient pays at each pharmacy is determined by how their benefits are set up. So in that sense, there would be equality as far as and that's what I talked about earlier, is that we don't have in Wyoming, we don't have the in-network, out-of-network, preferred pharmacy, non-preferred pharmacy. We don't have that element because of the rural nature of Wyoming. All of the pharmacies in Wyoming are in our network. So there isn't that dynamic that you see in some other states that are a little more populous, that do have those things.
One more question, Senator McEwen.
Thank you, Mr. Chairman. I go back to what I think I understand. The PBM set the prices to the pharmacies, and we can pin this on the insurance company. We can move it around to anything you want to, but at the end of the day, do you remember our discussion on bananas? The cost of a banana is the cost of a banana. If I have to pay $10 for a banana, and that place out of Bentonville, Arkansas gets a banana for $1, I'm going to get my lunch eaten. I won't be selling any bananas. So I go back to, are we really developing an even playing field?
Chair Baldwin and Senator McEwen, thank you for the banana reference. I remember that, and so does. But I do want to address this. I'm so sorry. My throat is really dry. Just give me a minute.
While you catch your voice, I want to just give everybody here a plan. At 9:30, we plan on closing public comment. So we have time to work this bill. So keep that in mind as you're commenting and testifying. Go ahead, Regina.
Okay, so Chair Baldwin and Senator McEwen. I'm so sorry. I'm not feeling well today. Can you repeat the question? I apologize.
Senator or Chairman Baldwin. One last time. I believe the PBM set the prices of the drugs. And if everybody's operating on about a same percent margin, I'm wondering how one pharmacy is selling, from testimony I heard today, a prescription for $30 and another one selling it for $5. And we're saying we're not driving people or shaping the market. To me, it's almost price fixing. And my question is, do you think the playing field is even?
Thank you, Chair Baldwin and Senator McEwen. I appreciate you repeating that because now I have a very clear understanding what the question is. So I want to clarify, PBMs don't set the prices for drugs. The price for drugs is set by the manufacturers, so the companies that make the drugs, whether it be a brand or a generic. We also don't set the prices that community pharmacies pay in order to buy those prescriptions drugs. That's set by the wholesalers and the distributors. What we do is set reimbursement rates. So we look at the cost of drugs and determine, what's an equitable, what's reimbursement that's available out there. What can the pharmacies buy the products for? Because again, I think we've talked about this during the interim. We don't have direct line of sight into the pharmacies purchasing contracts. But what we have to do is look at different national standards and see like, okay, here's a range of prices that are available for these generic drugs. Here, they're made by different manufacturers. Here's a price that we will set based on this range of prices that a drug is available for, to help incentivize pharmacies to buy smart. So buy that. I think I had Tylenol bottles when we first started talking back in June, to buy that manufacturer that has a lower price option available as opposed to the higher price. So to me, I think there isn't even playing field, because that is equally applied whether you're a pharmacy that's owned by a PBM or not a pharmacy owned by a PBM.
Go ahead, Senator McKeon.
Mr. Chairman, one more question. So in your mind, a pharmacy owned by a PBM does not have an advantage over a pharmacy that isn't owned by a PBM?
Go ahead.
In my mind, it doesn't, but we don't own any pharmacies. So that may be another question for another one of the members. And I think we have a PCMA that'll be up to represent the industry later on.
And for the final question before we move on, Senator Hutchings.
Thank you, Mr. Chairman. Ms. Lugina, Prime Therapeutics, one question, did they make a profit last year? And then number two question, or just comment, I don't see a dispensing fee anywhere in this bill. So I'm wondering where those amounts are coming from.
Chair Baldwin and Senator Hutchings. So Prime Therapeutics is not a publicly traded company. We're owned by those 18 Blue Cross Blue Shield plans across the nation. So any money that we make is passed right back to our owners. So we're different than than all of the other PBMs where they're publicly traded and they have profit and loss statements that are available. So all of any revenue that we generate or anything that we do goes back to our plan owners. And then your second question, can you remind me what that was?
Mr. Chairman, yes, Lugina, just quickly to follow up with that comment. If you're not making a profit, or if you are and you're passing it back to the insurance company, then it appears to me that the insurance companies should be made whole, or maybe you should pass it on to the pharmacist. Just a thought. And the second comment was, I don't see a dispensing fee in this bill. And I keep hearing about costs going up because of the dispensing fee, but I don't see it. Do you know where that is in the bill?
Right. So Chair Baldwin and Senator Hutchings. So that would be on page 15, lines 10 through 12, which has the pharmacist services definition. There, you are correct. There is no dispensing fee detailed as have been in previous versions, but because it's a combination of products and services, we have used the figures that the proponents have used in previous discussions, the 1049 as well as the 1240 amount.
Okay, thank you, Virginia. I see Tony has been waiting patiently in line there. We see Tony's, I believe it says Tony, is that correct?
Yes, Mr. Chairman.
There you are. We can hear you, but we can't see you.
Oh. Let's see. Let me try starting the camera over again.
And if you can't get it for some reason, Tony, we love your voice, even if we can't see your
There.
face. Go ahead and talk to us.
Thank you very much, Mr. Chairman, members of the committee. My name is Tony Gagliardi. I'm the Wyoming State Director for the National Federation of Independent Business. I have the honor of representing approximately 2,700 small business owners in the state of Wyoming. I'd like to first start by my thanks to Senator Hutchings and Representative Flitner for their tireless efforts this summer in bringing the task force together and meeting and hearing from all the stakeholders on both sides of the issue. Our position is supportive of this bill. Small local pharmacies are not requesting special treatment. What they're asking for is to be able to compete on a level playing field. Senate File 36 proposes to make that possible. NFIB is supportive of anything that limits fees charged to the local pharmacy. It does, and Senate File 36 does several different things. And I'm not going to go into specifics on each one due to time constraints on the committee, but limitations on spread pricing, the pharmacy benefit manager audits, it changes the way audits are conducted and then within what time period. I think it will be a benefit to the small local pharmacy. It addresses the level of reimbursement to the pharmacy and ensuring small local pharmacies are not incurring losses on the fulfillment of prescription. We heard testimony this summer that said often was the case that a local pharmacy would dispense a medication only to be reimbursed less than what they had to pay for that medication in order to dispense it. Keeping things short, I would like to thank this committee for allowing the stakeholder process and all the stakeholders to come together during the interim and discuss the topic. And in closing, I would like to restate the fact that the local independent pharmacy is often the only tie a resident might have to healthcare services. And in some cases, that relationship with the local pharmacy has gone on for decades, and that's what we want to preserve. Thank you very much, and thank you to this committee.
Thank you, Mr. Gagliardi. Any questions quickly for Mr. Gagliardi? None. Thank you very much for your testimony. Public and testimony, it's 9:13. I mean, we have 17 minutes left before we close, hopefully, and move ahead with moving the bill. So what I'd like is two folks to come up. This is the lion and the lamb next to each other. I would like one opponent and one in favor to come up and occupy the chairs. They're leaping into action. So one opponent and one. Okay, we got an opposed and we got an in favor. I only need one in favor. You can fight over it, but he's opposed. So I got one in favor, one opposed. That's all I want right now. Okay. Have a seat. He can observe from up there. It's a better seat. Okay, let's hear from one in favor, please. If you would introduce yourself and address the committee.
My name is Kim Kruger. I'm the Dean of the School of Pharmacy. And
Is your mic on, sir?
What's that?
Is your mic on?
It's green.
Okay, speak close. Okay.
Okay, now it's green. Can you hear me?
Better? Yes, go ahead.
Okay. My name is Kim Kruger. I'm the Dean of the School of Pharmacy at the University of Wyoming. I'm speaking in favor of this bill. We use community pharmacies throughout the state as training sites for our students. I've been with the university for 16 years, and in the past year, I've heard from more alumni and preceptors that they are at risk of closing their doors. I fear that if no action is taken, community pharmacies across the state will close. This will impact our training ability, but more importantly, it will impact the communities in Wyoming. So I'll end my testimony there. Thank you.
Pretty good questions, committee. No questions. Opposition, go ahead, sir. Welcome to our committee.
Thank you very much, Mr. Chairman, members of the committee. My name is Jonathan Buxton. I'm with Pharmaceutical Care Management Association. We're the national association that represents PBMs. Visited with you all back in the fall. Great to be back in Wyoming and get this opportunity. We are opposed to the bill, and it's on some we've hammered out all the details. We've talked about all the things. I'm going to take it back to the very basics of economics. You cannot pay more and pay less. And so if we're paying more, we're not paying less. And so if this committee in the state of Wyoming decides that they want to supplement or subsidize pharmacist, then there's ways to do that that don't require employers and small groups to pay for that. Y'all can do it through taxes and subsidies. You can do it lots of different mechanisms, but this is shifting cost to pay pharmacists more to those plan sponsors. And there's a lot of details. There's a lot of acronyms that we gum things up with, but I just go back to the very basic principle. You cannot pay more and pay less. This bill is mandating paying more. That means people will not be paying less, whether that's deductibles, copays, or premiums. And the pharmacists will benefit, but it's going to be on the backs of the patients and the employers that are paying those bills. With that, I'll stand for questions.
Questions, committee, Senator McEwen.
I agree with everything you just said. You cannot pay more and pay less. However, the issue isn't paying more and paying less. The issue is the vertical integration. The issue is the pharmacies, Big Pharma owns the PBM owns the pharmacy. And as they own that whole vertical, they have a huge advantage. I heard testimony today in support of them or against this bill that said, well, the pharmacies that are supported by PBMs can charge lower prices because they're making money with the PBM. And yet the independent is forced to buy from the PBM or deal with the PBM. So I'm going to ask you the same question. Do you think this playing field is even?
I think we have sorry. Thank you. Thank you, Mr. Chair. Apologize. Thank you, Mr. Chair, Senator McEwen. We have a market-based system right now where people can contract, they sign contracts, they agree to those contracts. And when it comes to, you saw it today with the state plan. The state plan said, when we're signing this contract, we want you to pay independents more. They made the market-based choice to pay independents more through their contract. So we have people that are signing contracts, agreeing to contracts, and being paid according to those contracts. So I do believe that it is fair. PBMs, pharma is the one that creates the drugs. Pharma sets the price for drugs. PBMs aren't owned by pharma. We actually negotiate with pharma to push those prices down by supplying a pool of people, our insureds. And that's where we get the benefit of pushing that price down is in those negotiations. We're not owned by them. We're actually a different part of the supply chain.
Senator Hutchins.
Thank you, Mr. Chairman. I don't know if this is weird, but I'd like to allow Mr. Kruger to comment on some of the statements that have been made since he's there to help maybe clarify for us anything you feel needs clarification on. If you don't mind, Mr. Chairman, can we have that?
No, that's fine.
Mr. Chair, Senator Hutchins, thank you for that. There's a lot of talk about, yes, pharmacies, we give the pharmacies the contract and they sign it, therefore they must be willing participants. To a certain extent, that is true. However, if that contract represents 80% of your business, even if they say, we're going to give it to you and you're going to make 20% less this year, you don't have a whole lot of choice. If 80% of your clients are going to be shifted to mail order, if there's no other pharmacy in town. So yes, they do sign the contracts, but that doesn't mean that they're making profits on it.
Senator McEwen.
I'm confused, so maybe you can help clarify something for me. I've listened to people testify in opposition to this bill. The end users are telling me it's going to raise costs. That's why they're against it. And you're telling me it doesn't raise costs. That's why you're against it. I'm confused. If the playing field's even, how can the costs go up through this bill?
Thank you, Mr. Chair. Senator McEwen, if I misspoke, I apologize. I am absolutely opposed to this because it will increase cost. this is setting a specific reimbursement for pharmacists that is currently higher than what they are being paid now. And there was talk in the committee about amending back in the dispensing fee, which is a lot of the cost driver. But no, this absolutely does raise cost. And that doesn't even get into the impact on patients themselves and the patient safety. This bill allows a pharmacist to refuse to provide prescription drugs to a patient because they're not making enough money on that fill. That's a huge patient safety issue. So this bill does increase cost, and this bill does put patients at risk. And saying, well, that's why we have to oppose it.
One more quick question. I'd like to take one more online. So let's make it
Thank
quick,
you.
please.
Mr. Chairman, can you tell us where in the bill that it says that the pharmacist can refuse to fill prescriptions, and where in the bill that it shows that it's going to raise costs? Can you show me?
Absolutely. I'm flipping over there now.
Go ahead, sir.
Thank you, Mr. Chair.
Thank you.
I'm absolutely, Senator Hutchins, I'm flipping over there now. It's
Take your time.
There it is. Page 18, lines 14 through 18, a pharmacist may decline to provide pharmacist services to a patient or pharmacy benefit managers if, according to the maximum allowable cost list, the pharmacy would be paid less than the pharmacy's acquisition cost for pharmacist services. That's the patient or pharmacist can deny access to drugs if they're not being reimbursed what they paid.
Mr. Chairman, is that reasonable?
Thank you, Mr. Chair. Senator Hutchins, it's a huge patient safety issue. I agree. A pharmacist can deny service. But what you're saying is that, and one of the reasons PBM's contract with pharmacists to not deny service is because we want to make sure those patients get the right drug at the right time. And by withholding that drug, it puts that patient at risk all over how much the pharmacist bought the drug for. So there's no incentive for them to buy better, and because they can just refuse to fill.
I have to.
Okay, go ahead.
Thank you, Mr. Chairman. We're talking about our local pharmacists who see Bill, Norma, Jean every day. They go shopping together. They go to church together. Their kids go to school together. Do you honestly think there's a large percentage or even a minor percentage of these local pharmacists that are going to deny someone a drug to the point where it's just going to be patient safety? Do we see that happening? Thank you.
Go ahead, sir.
Thank you, Mr. Chair. Senator Hutchins. It is enough of a risk of patient safety that our members contract with pharmacists to not allow it.
Thank you.
Okay, Senator Bouchard.
Thank you, Mr. Chairman. You know, when I look at this part that you pointed to, it goes right back to where we started a long time ago, where the pharmacists that are being affected here are subsidizing the medicine that's going out the door. This says here is that if they're not going to get reimbursed, they're not going to ship it over their counter, because what's happened with all the clawbacks, everything else that happens, they put that drug out there and then they don't get paid for it. They're going to go out of business. That's what this bill is about.
Is that in the form of a question, sir?
The question is, isn't this what is a normal business practice right here that's in that same part that you mentioned? Isn't that across the board? I don't care if you're selling lumber or bananas. Isn't that the standard business practice in America?
Thank you, Mr. Chair. Senator Bouchard, it may be the standard business practice, except that, as was mentioned earlier, not every business makes profit on every single item that they sell. This is a huge safety risk for patients. And it's one of those times when there also removes any incentive for them to purchase those bananas at the best price possible. And so when they're out there purchasing, knowing that they don't have to fill, there's no incentive to purchase at the best price possible.
Quick follow-up. We need to keep moving.
Thank you, Mr. Chairman. So, and I just want to get a wrap around this, because you represent how many PBMs, and where we're not being transparent here is I don't know how much profit all those PBMs are making. And you keep pointing to these pharmacists that could lose money. I think it should be disclosed to this committee how much all that profit is. And everybody who's testified on behalf of PBMs, we should have those figures up here in front of us so we can see where that money is. Because nobody's talking about giving up the money on that side. They're just saying, let these pharmacists got to pay it out. So are you willing to give us those figures? Because it's hard to find. I looked at Prime. It looks like they're over 500 billion in profits, just them. That's just one. So, or revenues at least. I'd like to see all that. Are you willing to disclose all of that information to us?
Thank you, Mr. Chair.
Go ahead, sir.
Senator Bouchard, I don't have that information. I'm happy to go pull SEC filings so that you can look at the profit and loss statements of our members. At the end of the day, what this committee has failed to fully appreciate is that for the specific items in this bill and the cost increase that go through with it, PBMs are not paying with our money. We are paying with Wyoming employers' money. The counties had a great example. They are self-insured. All the PBM does is manage the claim and spend the county's money. All PBMs do is manage the claim and spend the employer's money. So these costs go up. It is not paid by us. We make our money either through transaction fees, kind of flat rates for the issuing or for taking care of the transactions. Some companies use spread pricing based upon the contract that they sign with the employers. But at the end of the day, when it comes to the actual cost increase in this bill, that's coming directly from the pockets of Wyoming businesses and patients.
Okay, committee, what I'd like to do is take one more online testimony. If I could, if we can get one raised hand and we can have lots of discussion. No, ma'am, I needed one and one. I'm sorry.
Mr. Chairman, we don't have anyone else online.
No more online. You're in luck. Go ahead. Quick testimony and what, any quick questions?
Thank you, Chairman. I appreciate that. My name is Diana Madvig with Noble Benefits, and I'm a consultant, and I manage a lot of government entities and a lot of large employers in Wyoming. And I'm going to narrow it down really quick on a point that we haven't really hit today, which is the mail order. When we utilize mail order, we utilize it in the specialty category more than we do anything else. I can tell you my entire block of business, if I exclude specialty, I'm going to have 2% that might take maintenance meds through mail order. And the rest we use in our local pharmacy. You know why? Because if I have to sit there in front of Commissioner Novotny in an open meeting in Johnson County and explain how come I'm trying to put the 2 pharmacies that they have in town that are small pharmacies out of business, it's not going to bode well for me, and it's not going to bode well for them. There's a lot of us in this industry that are trying hard to build that, but we also know that as bad as the Affordable Care Act got into bed with pharma, not so much PBMs, but pharma, and how much we have battled what has incurred between rebates and what we could have with a biosimilar med and how to balance that out became so darn complex. I don't want to break out and say, let's not use our small town pharmacy. We can't afford to sell the ship. And when I'm sitting here looking at a medication that's $250,000 a year, or I could take it out into a mail order and get that, do I battle with trying to get it to base in Wyoming overnight in a quality that is worthy of being able to utilize? We do, but we have really worked hard with the mail order companies to make sure that we're preparing it so we can stabilize it. I have never, in my 17 years of doing only group plans, I have never had an employee have to go out and pay an extra $7,000 for a med, because we take care of that. If we have a problem, I go back and tell the mail order PBM, you're going to have to redo that, and we need to fix it so when it comes in next time, we can. So a lot of the smoke and mirrors, please don't take the mail order away from us because of the cost of it. And don't control where the supply chain is, because even though I agree vertical integration in the PBM world is killing us. We went through this, you guys, 10 years ago with the insurance companies and vertical integration. I make my living doing self-funded, which means I do the opposite of what it feels like you do. We do everything we can to break the financial tentacles away from the third-party insurance companies and the PBMs to make sure that the employer group that's going self-funded is getting the lowest rate that we can affordably place without sinking the plan. Because I have a fiduciary responsibility to do that. You guys ironically do with the state plan too. And how do we cost shift that? If the state plan is going to have a 10.8% change or $7.4 million change, are you guys going to push that back on the cost to the employees? Or is the state going to absorb it so that you can create a more stable free enterprise? That's a question you guys are going to come up to answer. And it's a question that the county commissioners and the city council people that I work for, they're going to have to address that question too. And we see the impact. I'm open to anything that helps us to control cost. But when we restrict free enterprise, we also damage ourselves and we don't really believe in what capitalism is. Thank you.
Senator McEwen, you ask any one of these three to sit up here, jump in. Go ahead, Senator McEwen.
I don't believe this bill restricts free enterprise. I believe this bill promotes free enterprise. I don't think, I want to know how you can explain to me what's in this bill that restricts free enterprise. It's not free enterprise. Nobody's proven to me that this is an even playing field. And if it's not an even playing field, it certainly isn't free enterprise. So please explain to me how this is going to restrict free enterprise. And either of you can do that. Thank you, Mr. Chairman.
Go ahead.
Mr. Chairman, through you, Senator McEwen, when we can't do mail order and find a more cost-effective way to deliver that prescription safely to a member that's utilizing that medication, we're restricting free enterprise. If I have to buy it local at a small pharmacy that's going to have to keep it stored on their shelves only to toss it away because the member leaves or changes medication, the expense of that in a very normal or narrow area for the smaller pharmacy is more restricted. If I have to go to Walgreens and buy that prescription and pay 25% more to buy it at Walgreens or Walmart, that's not helping the plan. And to me, we either have the ability to go out and compete in the free market because each one of the pharmacies create their own network of distribution to get the medication delivered to them. I can't control what contracts they sign or what buying power they have in bringing it in. But I do know that I have a financial liability and obligation to the groups that I manage to get it at the lowest cost affordable to my plan. Otherwise, then I am not doing my job correctly. And to me, that affects free enterprise. If I could say I'm losing 25% by buying it local.
Okay, committee, you have a choice now. I'm going to offer this to you and you can decide, the four of you, and I'll decide. But we can continue to ask questions and take testimony, or we can close and work the bill. If we close and continue taking testimony, which is certainly your option, we'll continue this on Friday, but that's your option. So committee, what's your pleasure?
Mr. Chairman, I'm good with moving forward with the bill. Let's stop here and move forward.
Okay. Thank you very much, public.
Thank you for your time.
We appreciate your time. We appreciate you coming. I know there's those out there with lots of burning desire to talk and talk all you want after this meeting, and you got lots of legislators up here to talk to, and this is not the end of the road. If this bill passes forward, you know, there's another committee will hear it. It'll be heard on the floor, so it's got a long ways to go. So with that said, committee, what's your pleasure? Bill moved by Senator Hutchings. Let's get a second. Second by Senator McEwen. Okay, committee, let's go through this bill page by page really quickly if we can. You've got a couple of amendments there that were suggested. Anything for page 1? Nothing for page 1. Page 2. Page 3. Page 4. Go ahead, Senator Hutchins.
It's just a, let's see, page 4,
Yes, ma'am.
line 2. After the word fraudulently, I'd like to place a period and delete the remainder of the line. In other words, we're deleting or erroneously in that line, Mr. Chairman.
Okay. Any discussion or questions about that? Committee? Okay. Question on the amendment. All those in favor of this amendment proposed by Senator Hutchins, please say aye.
Aye.
All opposed? Okay, got that. Okay. Anything else on page 4? Page 5.
Page 5, Mr. Chairman, we do have an amendment from the Department of Insurance, I believe they are. Page 5, line 16. Typo, change that 25-52107 to 26-52107.
Correct. Put it in the correct section. Any discussion or comments on that? All in favor of that proposed amendment, say aye. Aye opposed? No, that amendment passes. Anything else on page 5? Page 6.
Page 6, Mr. Chairman, line 16, same type of error. Change the 25 and the -52-109 to 26.
Any discussion? All those in favor of proposed amendment, say aye. Opposed? Okay, let's move on then. Anything else on page 6? Page 7.
Yes, Mr. Chairman, page 7, line 17.
Go ahead.
We'd like to write before the colon inserts but not limited to. So it would read on line 17, after the period, prohibited retaliation includes but is not limited to. Excuse me.
Okay. And can you tell us what your reasoning is for that?
It's just a suggestion for casting a wider net when outlining prohibited retaliation behaviors. Just kind of like, okay, it's not just, you can't do this, but this is not what we're gonna limit it to.
Any discussion? Like, my experience is that sometimes that's not the best phrase to put in because it and I'm not a lawyer by any
Gotcha.
stretch of the imagination. But sometimes that opens it up too wide to where
Okay.
people can throw a lot of other things in. That's just my experience in legislation. I don't know any other discussion. Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. Just looking at the list, I'm a little concerned with the amendment because I don't want
Okay.
to muddy what we're doing.
No problem.
I think
Would you like to withdraw that or you want to
I'll
vote on it?
withdraw it, Mr. Chairman. Thank you.
Thank you very much. Anything else on page 7?
No, Mr. Chairman.
Page 8? Page 9? Page 10? Page 11? How about page 12? Page 13? There was a proposed, was suggested that we pull that final paragraph by one testimony. Does anybody would like to consider that? The health benefit plan paragraph. I don't know that it hurts anything to be in there. It may not be necessary, but I don't know that it hurts anything to be in there. Go ahead, Senator Hutchins.
Mr. Chairman, if you allow me to get with the proposer of that amendment, got her name. Oh. I forgot her name, but I know she's here.
You know
If
her
we
name
can
or
get
face?
together and discuss that, I'd like to do that, because if that's valid, I'd like it to go. If it's not, stay, or help you understand what we're doing there.
If you do that, Senator Hutchins, why don't you do that and make a
Thank
committee
you.
of the whole amendment? Okay, very
Thank
good.
you.
Anything else on page 13? Page 14. Page 15. Page 16. Page 17. Page 18.
Let's see, 18. Okay.
Page 19. We have another amendment suggested by Department of Insurance, if anyone would like to offer that. I hear no takers. Go ahead, Senator Bouchard.
Mr. Chairman, we're just looking at the language there and we're looking at the bill.
Mhm.
Certainly looks like maybe not as specific, but there's language there, so I don't know. I mean, I don't know why we need to do anything different than what I see in the bill.
Further discussion committee, and certainly it's your prerogative now. If you would like to ask the insurance commissioner to answer any question on that, we can.
For me, I'd like to sit with the commissioner again, hopefully this afternoon, and discuss his proposed changes, how they marry up. And if, hopefully we can come to an agreement. Section B is an issue with me with that 250,000. Maybe I can work with him on that this afternoon as well. And
We will leave that in your hands and get with him, and you'll have another committee of the whole amendment.
you got it, Mr. Chairman.
Okay, anything else on page 19? Go ahead, Senator Bouchard. Oh, turn it off. I didn't know them. Page 20. Any further amendments on anyone's mind? Amendments, I believe we're ready for the vote. Go ahead and take a roll call. Or before you do that, any further discussion on the bill in total? Any comments? Go ahead, Senator Hutchins.
Just a quick comment. One of the things I've noticed, and I'm new to this committee. I've seen and heard a lot of testimony where they'll come up and just say, this is what's gonna happen. And no one's appears to have read the bill, investigated. We don't have any charts, any graphs, any figures, where the poor pharmacist in this case brought us information on states from Alabama to West Virginia or Wyoming to show us how these laws have come into place. We have charts and graphs on the vertical integration of the PBM. We have testimony, we have letters, we have, this is what the bill's gonna do. We got all that information from that group, and it really helped me understand where I'm going, how I'm gonna vote, because just coming up and sitting down and saying, this is gonna cost us more with no facts or figures or evidence it makes it hard for us to make, or me, to make a clear decision. So thank you, Mr. Chairman, for that. 2
And that's-
seconds.
That's actually a very good observation. And as this bill has a lot further to go, should it pass today, which I suspect it will, is that that's something that needs to be prepared. It needs to be out there for those in opposition or those in support. Make sure that next committee or those on the floor, on the Senate or the House floor, have that information and graphs, et cetera. Because I suspect that some of them are listening in on this committee meeting, and they will take that to heart, and they will be asking you for those things. Okay. That being said, roll call, please.
This is for Senate File 36. Senator Bouchard.
Aye.
Senator Furphy.
No.
Senator Hutchins.
Aye.
Senator McCune,
Aye.
Chairman Baldwin,
No.
Senate File 36, 3 aye, 2 no,
That bill has passed committee.
and that would be due pass amended.
Do pass amendment.
Okay.
Committee that left us two bills on the agenda, and I knew that was going to happen today, but I put them on there just in case somebody had too much coffee this morning and we got through it too fast.
Excuse me, do you want to have someone
ahead.
present this on the floor?
I believe Senator Hutchings volunteered for that.
Okay.
She's been begging, unless somebody else wants to do it for her. No volunteers? Senator Hutchings, it's yours. Okay, and that and with that in mind, the other two bills that are coming up that we'll be doing Friday morning at 8 o'clock, you can sleep in. If you got a burning desire to present one of them on the floor, read it over good, because there's two bills and three senators to choose those two bills. So you can arm wrestle or whatever you want to do, but okay, thank you very much. We appreciate y'all being here.